up? What's up? It's your girl. My name has changed. So it's your girl, Nurse Sharita Bonita. Yay! I know, friends. I know it's been a minute. It's been a minute. And I'm going to explain what took me so long getting back to you guys. I'm doing great. If you've been watching my shorts, I've been doing good. Um, I've just been in school, on this grind, trying to make it through the first semester of nursing school. What's so exciting, guys, is you guys know by now, y'all know the real. Y'all know that I have made it through the first semester. I passed fundamentals of nursing with a B, and I passed pharmacology with a B as well. So I guess you guys want to know, how did I pass both of those? I know y'all want some more tips. Last time I talked to you guys, I gave y'all tips on how Notebook LM will help you get through nursing school. And I'm not even going to hold you or tell you no lies. Notebook LM helped me. Get through my first semester with flying colors, you guys. Um, I guess I'm just going to give you my thoughts of how I feel the first semester went. Actually, today was the last day of the semester. Today, this morning, I took my final in pharmacology and clock it. Your girl passed that one too. So we're just gonna today we're just gonna do a small little catch up just to let you guys know, um, talk about how I made it through in the end and give you guys some updates on that. So I, I know you guys probably got a lot of questions. Please don't be shy. If you have questions, please, please, please leave them in the comment box below. And yes, your girl, I am going to answer them for you. It would be so great if I could get a lot of questions in, and then I could do like a whole Q&A, and just talk about some more things that I did to help me get through this semester. But today we're just going to talk about how I felt about this semester, um, the ups, the downs, and everything in between of this semester, and hopefully not drag it out more than that. But before we start, I want to talk about my glass, guys. I found this glass. This glass is like a purple. It's like a very iridescent kind of purple. I don't know if it picks up in the camera, but I love it. I'm a girl that's always down for a good cocktail glass, and I'm also down for a good cocktail. So today, which is really tonight, for you guys, you'll get this video tomorrow. Um, but today is what is today? Today is Wednesday night. Um, the last day of the semester. And so I made myself a cocktail. Let me tell you what's in this cocktail in case you want to check it out for yourself, or you girly girls that like your drinks but you don't like them too strong. I am drinking apple Hennessy, and in my apple Hennessy I put some fruit juice in what actually it's like a strawberry fruit juice, like a Welch's. I put a little bit of that in here. Of course, I put some ice in here that melted. I also put some cotton candy syrup, blue syrup, a little bit of cotton candy syrup because I love the taste of cotton candy. And I also put a little bit of a Alani energy drink, just a little bit. So I don't plan on being up all night long, but I just put a little bit in it, and it is yummy. So first of all, before we get this started, let's go ahead and throw our glasses up and say cheers to your girl. Cheers for coming through with that win. Mm, yummy, yummy. That tastes so good, so good. Okay, so let's get into it because you know your girl is so excited to talk about it. Okay, so I want to say my first thoughts going into my first semester, definitely a little nervous because I wasn't sure on what to expect. I have to tell you with fundamentals, my first exam in fundamentals, I did fail. The first exam I failed, not horribly fail, but I didn't make an 80%. And so with our school, you have to at least make a 80% on your exams in order to be considered passing. So I won't even hold you. The first exam in fundamentals of nursing, I didn't even hit at that 80% mark. Um, and it simply comes down to this, and I want you guys to be aware of this. It comes down to the verbiage. Okay, it comes down to the verbiage, knowing the verbiage that is in the questions. Um, with that exam, there were things that was being asked that we didn't know that's what was being asked. And one of those things you have to pay attention to when it's asking you a question. For example, it might say, well, what is something that would require immediate action? And so you might be reading the answers and you're thinking, they're not telling me what's going to require immediate action. Well, they're telling you what's in the scenario is wrong. And they want you to pick out what is wrong. So if you see the word immediate action, it means they're asking you what is wrong. They want you to give the answer for what is wrong. So that's just an example. I'm just giving you guys one example of the verbiage. And one thing about our instructors, my instructor, if we didn't hit an 80, she would just call us into the office and she would actually pull up the exam and go back through your personal exam to see what was it that you got wrong and if you noticed anything yourself. And to be honest, the first one I could have just kicked myself because it was things that I noticed off the back. I was like, why did I even select that, you know? um but it didn't happen again, guys. It did not happen again. I'm proud to let you guys know. After that exam, all my other exams with her, I went up in grade. So it's like every exam I took from that point on, my grade on an exam kept increasing. So let's say I hit 80% on the dot on one. Well, the one after that I hit like 83%. I just kept going up, and so that's an amazing feeling. I kept, and I guys, don't be down on yourself. I really want to say that. Don't be down on yourself. Don't feel like you're not doing as good as you feel you should be doing. You know, if you're passing, you're doing good. Okay. Give yourself some grace just for that point alone. Okay. Don't overstress yourself out. The large part of passing exams is actually not just knowing the content, but knowing how to do process of elimination. That's something that our fundamentals instructor really drilled into us really hard. Um, we started off where towards an hour or 30 minutes at the end of class or at the end of lecture, at the end of lab, she would sit down and go through HETC questions with us on the screen and have us do the process of elimination. She taught us how to do process of elimination, and we practice and practice and practice doing that process of elimination. That is the goal for passing nursing school, friends. That is the goal to passing nursing school. I just gave you guys the gem. That's the number one gem to pass nursing school, okay? Process of elimination on the test questions. Look at the question, Read it twice because a good, prudent nurse always reads the question twice. Okay. And then eliminate the answers. Don't go in it and say, okay, I'm looking for the answer. No, go into it finding what answers you know absolutely don't make any sense at all. Okay, period. Take that out. Okay, if there's any words that you are not familiar with, and trust me, there's going to be many, don't worry about it. Make sure you research those words. Research and study the words so that you know what they mean. Because that's simple. If you know what it means, then you know what the question is asking you for. If you don't know what the word means, you don't know what the question is asking you for. Okay. So that's a tip. And how you get really good at that, for me, was my instructor, she did the practice questions with us, right? But I did the work on my own, and I created practice quizzes through Gemini, which is the Google AI, and through Chat GPT, and also through SharePath AI. SharePath AI is it's the same as Chat GPT, but you can only get access to that if you're in the nursing program. Once you're in the nurses program, you have access to that, and you can use that to create practice quizzes on any information that your instructor gives out to you, to review. I encourage everyone to do that. Create practice quizzes and do these quizzes over and over and over until you yourself know that you are confident in the information. You know this information backwards and forwards. And this is something I use for nursing fundamentals, and I used it for pharmacology as well. And that's the second thing that is going to help you succeed. You will succeed in nursing school if you just practice those things. I feel like in this program so far, I've been majorly relaxed, to be honest. I haven't been in much of a situation where I've been flustered through this program to where I felt like I was going to pull my teeth out or pull my hair out, kind of thing. No, you do get checked off and evaluated on certain things. For example, we had to do a medication management pass, that we had to get checked off on, that we had to physically do, and you have to score. In my school, you have to score at least a 90% in order to be considered passing on that, how to administer medication properly. And that's something, to be honest, I think as a class, we hyped it up way more than what it really was, what it really came down to. Um, I actually got a whole 95 on that. Clock it again. So that just goes to show you guys, you you can excel in the nursing program. Just practice. Practice. And also, one thing that my fundamentals instructor honed in on us was the number one thing to do when you're coming for an exam, before you come to that exam, the thing you need to work on is being prepared. Being prepared. That's very simple. Don't go into any exam, any lab practicum or check off, and you're not prepared. That's the thing. And it's simple to prepare. It's just to go over the information, go over the steps for medication administration. I practice this in the lab, but not just in the lab. I practice it at home with my children as the patients multiple times, making sure I knew my steps and making sure I knew my steps by heart. Okay. The reason why I say this isn't going to be as hard as what it probably sounds right now And with the medication pass, you get two medications. You don't know what medications you're going to get. You have to do the dosage calculations for those medications, and you have to administer the medications, tell where you're administering them at. You have to actually do it. You have to actually know the needle size that you're using. You have to know when to put air in the container. You you need to know to verify if the patient has allergies twice before you administer the medication. You need to know to ask if the patient has any problems swallowing. You want to make sure you do that. It's a whole big process, and no need for me to get into medication administration right now. But what's going to make this so much simpler for you that they don't tell you is that we did this towards the end. Okay. By this time, we had already finished all of our clinicals before, which we had already finished 2 months of clinicals, which means we had finished 2 months of working in the hospital with patients. So, most of the stuff that's on the medication administration outside of actually giving medication, because you won't be given medications yet. Okay, when we took, well, I don't know with you guys, but for our first semester, we're not given medications yet. Going into second semester, we will. So basically, you already knew the basics of when you come into a patient's room, um, how you should introduce yourself, and I'm going to give you guys an example because, like I say, I'm not a gatekeeper. I believe in sharing. So I want to give you guys an example because these are things that if you are thinking about getting into the nursing program, these are things that you can practice ahead of time, before you even start the program. And I would very much encourage you to start these things ahead of time because often clinicals start pretty early, within the first semester. Okay. So, one of the things when you come into a nurse room, and these are things you're going to need to know by heart, friends. Okay. Hi, my name is Sharita, and I'll be your student nurse for the day. I'm going to close the door for privacy. And can you verify your name and date of birth while you're looking at their wristband that has their name and date of birth on it? Oh, Miss Smith, how are you doing today? Oh, I'm doing fine. Miss Smith, are you in any pain today? And Miss Smith is going to say, and you're going to say, Miss Smith, are you having any pain today? On a scale of 0 to 10, with 10 being the worst and 0 being none at all, Miss Smith is going to say, oh, I feel like my pain level is at a 5. Doesn't even matter if you feel like her pain level is at a 5 or not. You still have to document what the patient feels their pain level is at regardless. So that's something to remember. When you go into a patient room, you always want to give privacy. Okay. You always want the questions that I just asked, those are questions they're going to check you off on to make sure that you're asking them the right questions. You want to go into the room and let the patient know what you are doing. Miss Smith, I'm in here today because I'm going to check your vital signs, okay? And then if the light is off, you say, Miss Smith, is it okay if I go ahead and turn this light on so I can see better? Or you can just make a statement and say, Miss Smith, I'm going to have to turn this light on a little bit just so I can see better, okay? Okay. So those are just a quick little of how you should approach a patient when you're dealing with a patient. If you've done patient care before, that's something that's self-explanatory. And that's something that's a part of your medication administration check off as well, making sure you say those things. Always check the patient's name and date of birth. Always always have the patient state what their name and date of birth is while you are looking at it. Before you ever administer any medication, you need to do a three medication check. Three times you need to do a medication check with the patient's name and date of birth according to their band and according to your Mars record as well, which is your EHR, your electronic health record. You want to make sure, whatever computer system the hospital facility is using, you want to make sure that you're checking, scan they armband. You want to do triple checks when it comes to medication. So that's my thoughts on fundamentals. I thought fundamentals was a great class. I ended up really, really enjoying fundamentals, everything that we did. I learned a lot. In clinicals, I got to see so much up close. I had patients that had massive wounds that were in need of wound care that I actually got to observe, which was very exciting, you know. So that was great. Um, so now let's move on to my thoughts about pharmacology. But before I do that, let's take a sip of our drink. Okay, pharmacology. I actually had a higher score in pharmacology than I had in fundamentals. Weird. I didn't think I would be. I heard so much bad stuff about pharmacology on TikTok and everything. So, you guys, listen to those things with a grain of salt. What I've learned in this program is that the first thing is that you definitely have to know your personal study style, how you study, not how I study. I can give you all the suggestions and share with you how I study, but at the end of the day, you got to find what works for you. That's the first step of nursing school. Um, Finding out how you study. Once I found out how I studied, I realized I was just excelling across the board, to be very honest with you. Like I said, one of the things with Notebook LM was just an amazing gem. I would put all my study notes, whatever it was I need to reiterate, and I wanted to put it in a podcast to listen to it wherever I was at, was the most amazing thing for me, because when I was preparing for an exam like this morning, the information, my notes that I had uploaded in Notebook LM that got transferred into a podcast, has male and female having a discussion, you know, about the different information. I listened to it this morning while I was getting dressed, and I listened to it all the way to school right before it was time for me to take my exam. So that for me was just a game changer for me. Okay. For me, I am a hands on learner, and I'm also a visual learner, but I am also an audio learner if it's in a podcast kind of format. It helps me to remember. I use that as a way to help me remember the information. Um, the second thing for pharmacology that I use as well for fundamentals is the practice quizzes that I put together. For pharmacology, our instructor told us that our tests would be based off of her PowerPoint presentations. So I would upload my whole PowerPoints into chat gpt. I would ask chat gpt to then create me a 30 question multiple choice quiz, to include the rationales and my answers at the end, and put it in an NCLEX format. Okay, those are the things, are very important questions to make sure you prompt in your quiz. If you have it in an NCLEX style format, that's the kind of format that you're going to see on your HETC exams. A HETC is the exam that you're going to have to take at the end of every class before you take your final. And it's quite honestly, it's going to kind of be in an NCLEX style. What does rationale means? I know you in the back, you was wondering about that. Rationales is basically, it will tell you why is the answer. Okay. That's another golden gem I'm giving you, friends, is to make sure you know your rationales. Okay. If you know your rationales, then you're never going to get that question wrong. No matter how the information is worded, you'll never get it wrong because you know your rationales. You know the reason why the answer is the answer. Okay. And before you start pharmacology, as well as fundamentals. Fundamentals, before you start, know your cranial nerves. Go over your cranial nerves before you even start the program. Make sure you memorize them, got them down pat before you start the program. With pharmacology, before you start the program, make sure you know your basic conversions, and that'll be another video I'll share with you guys to help you pass um, dosage calculation, dimensional analysis. I'll help you guys with that. Don't worry. Um, but coming in, you want to already know your basic conversions by heart. And I have the way to make sure you know them. Even my 12-year-old child knows them. Don't worry. I got you guys covered. And on top of your conversions, because you're going to need to use them in your dosage calculations, know your basic dosage calculations by heart also before you come into the program. um, Even go so far as to learn dimensional analysis. There are plenty videos on YouTube of people like Nurse Sarah, Level Up RN, and a whole bunch of other ones. I can't remember their names, that will give you a basic breakdown of your dosage calculations and your dimensional analysis. So that's something that I wish I would had known before I went into pharmacology. I wish I would have had known that when I was taking my prerequisites, because I really would have focused on making sure that I was knowing those. Because I'd have to tell you, dimensional analysis, I was not the best on, but you gotta be the best at it, because coming up in my next semester this summer in 11 days, I 2 weeks into the next semester, we have to take another dimensional analysis exam, and that's math, guys. Um, and it's not hard, so don't get scared. It's not hard, but at my school, we have to make at least a 90 on that exam. If we don't, we'll go into remediation. If you don't make a 90 in remediation, could let you go from the whole program. So, we all know what we're going to be doing this summer, right? Yeah, I got to get to the point where I'm at 100% in order to make sure that I make that 90. But I'm confident in myself for that. So let's go back to fundamentals about the HETC exams, what I think about the HETC exams. Love the HETC exams. They're not as scary as you're going to think at all. I actually did so well on my HETC exams that for my fundamentals class, I actually scored a 94% on my HETC exam. Clock it. Yes, your girl scored a 94%. That means I scored almost 100%. So, and the HETS exams basically just says they're just testing you with that pretty much at the end of every semester, just to see. It only counts for 2% of your grade, but it's to see how well would you do on the NCLEX. Would you be prepared for the NCLEX? So if you know you hit a 94%, you know you're prepared for that NCLEX. Even if my pharmacology one, I hit a 84%. Even if you hit a 84%, you're okay. You know, but they definitely want you to be as high as you can because they want to make sure that you're going to ace it. So, guys, I see this video has become longer than what I expected. 30 minutes of me and you guys trying to catch up. I know it's been a lot of information. I'm not going to hold you guys because I know you guys got so much to do, but I appreciate you guys giving me your time. And I'm so excited that I made it through the first semester. And you guys, I got the time now to upload more videos and tell you some more things about my first semester, which I will. I'm going to share some pictures as well. And I hope you guys enjoy it. I hope you guys enjoy the rest of your day. And until next time, Nursery to Bonita, I'm Audi 500. Love you guys.